surgical simulators have all but revolutionised how surgical training is delivered, and that's really looking back even throughout the entire history of surgical training and medicine. One of the fundamental reasons for that is that it allows for novice surgeons or experienced surgeons to undertake a surgical procedure, but without affording the patient any of the risks that would previously have been the case with live surgery.
I think surgical simulators are an essential part to modern training for several reasons. First of all, and most obviously, they reduce the steepness of a learning curve. So in other words, if I can come and use the simulator before I've ever done a particular eye operation and practice it 10, 20, 30 times, then immediately I'm already at an advantage. And actually that's something that we've proven in a study, so it does work from that perspective. In addition to that, if I find that there's a particular step during an operation that I'm finding more difficult or taking me longer, I can come to the simulator and just repeat that particular step multiple times.
So we've been lucky. We've been at the forefront of both surgical educational and research excellence for some years. And this device, with its latest software iterations, hardware iterations, are absolutely central for us to be able to continue to deliver both the safety benefits and training benefits that surgical simulation affords.
The reason why I'm most excited about the new simulator is that it allows you to perform tasks that you couldn't on the old one. And these are certain steps that are required for some more difficult cataract operations. It's also better at recreating the variety of cases that you may be faced with in real life. For example, cataracts that are very dense, cataracts or in patients who have small pupils. So I'm very grateful to supporters of the charity for their donations, without which we wouldn't have been able to purchase this piece of equipment. And I think that ultimately it will result in better quality training for trainees, and ultimately that will translate into better outcomes for patients.
My message for supporters of Moorfields Eye Charity is above all to say thank you for your generosity. It's thanks to the support from many hundreds of people that we can keep Moorfields Eye Hospital and the UCL Institute of Ophthalmology as the unique partnership to benefit people in London, people across the country, and ultimately globally, because the knowledge that is developed here is applied in practice and then is shared more widely.